Mula Pinaka Fiji. Today our press conference is done under a different mode. It will be, I've got cameraman in front of me, and then there's a screen that is outside of the viewers' eyes that have reporters that are zooming in. And we will be polling questions from those reporters at the end of this, at the end of our talks. Since yesterday, we've been investigating the potential for further exposure of COVID-19 in the Fiji CDC. Our medical and laboratory staff have not registered positive results at this time. However, we are in a process of deep cleaning and in decontaminating the center in line with advice that was received from the reference lab in Melbourne. As a result, there will be no testing on site for at least another 24 hours. The Fiji CDC is where we process the vast majority of COVID-19 tests. With the facility temporarily offline yesterday, the volume of our testing has decreased. Though testing had continued in Tamabua, Tumi Hospital, CWM Hospital, Lambasa Hospital and Lotok Hospital. Based on that testing, we currently have one new case of COVID-19 to report. The new case is a household member of the Lakana cases reported earlier. He was already in isolation in Navo Hospital when he registered a positive result. Given that his first test when he entered the quarantine was negative, we do not view him as a high-risk case for wider transmission. The CDC handles the bulk of our testing, and we focused on bringing it back online as soon and as safely as possible. Regardless of the temporary lull we expect in swab processing, it remains vital that we use the next 4 days to identify and swab the contacts of existing cases in Suva and Nosori. That is much easier when we know everyone is securely at home. And until we have a clearer idea of the extent of transmission in the Suva-Nosori area, this lockdown serves the dual purpose of putting a firm halt on further spread. There may be a community case we do not know about. Keeping these potentially positive people at home is the safest course of action. So the lockdown of Suva and Nosori is still scheduled to begin tonight at 11 p.m. and end at 4 a.m. on Wednesday, the 19th of May. We're going to use that window to trace and swab. Those are the marching orders of ministry-wide. Trace, swab, repeat. These swab results will go for processing at our operational testing sites until the Fiji CDC is fully back up and running. The results of that exercise will inform our next steps. So at this stage, we have not made a recommendation either way on the lockdown measures, whether it will extend to other areas or whether we will lengthen the duration. That will we will make at the end of the testing that we have done, and that will come as we come closer to the end of this current lockdown that we established for the first 4 days. If you're living in the Suva and Nosori and you find yourself feeling unwell at any point through the next 4 days, call 158. A team will visit you, or you may be referred to a screening clinic. Travel is permitted for medical emergencies. We have made that clear from day one of this outbreak. So anyone can receive treatment if they need it. That has included kidney dialysis patients who need to travel to receive life-sustaining treatment. The Ministry of Economy has announced the details of food ration delivery during the lockdown period. From this Sunday, the 16th of May at noon, Fijians living in Suva and Nosori who genuinely require an emergency food supply can call *161#. *161#. That's the number to call if you need food supply. Applicants must provide their name and other details, including the street address. As the Ministry of Economy has made clear, requests received before 12 p.m. on the 16th of May 2021 will not be registered. For the rest of Viti Levu, the new curfew hours from 6 p.m. until 4 a.m. come into effect from Saturday. Our regular advice applies as always. Wash your hands often and well, wear a mask, and maintain physical distance if you have any essential reason to leave your home. And also make sure that you have the Care Fiji app installed with Bluetooth turned on. For most part, you should be at home as well. Stay home. Home is where heroes manning the hospitals, health centers, guarding containment area borders, running tests at CDC and other laboratories all wish they could be. Instead, they are working to keep us safe. Honor that sacrifice. Stay home, save lives. For Suva and Nosori, this lockdown must be decisive. It can be if everyone cooperates. The Fiji police force will be enforcing the stay-at-home order on the streets. But the police cannot be in every community. They cannot stop every needless and potentially deadly interaction between different households. Only you, those living in the Suva Nosori area, can hold yourselves accountable for every hour of every day of this lockdown. I'd bet that some of you will receive a call or a text asking you to come out, hang out, or otherwise just to violate the lockdown measures. Don't do it. I'm telling you now, those asking you to break your bubble do not really care about you. They certainly do not care about the country. Ignore them, please. If you see gatherings of any size, report them. Those meetups can wait until they no longer put lives at risk. Keep your bubble small, keep yourself safe, keep the faith, Fiji, in science and in each other. Thank you.
Thank you. Good evening. As the Permanent Secretary has just announced, we have one new case to report. We've also got 5 patients who have recovered. This means there are now 48 active cases, 6 are border quarantine cases, 29 are of local transmission, and 6 are currently under investigation. 13 are under investigation, and we consider them community transmission cases until proven otherwise. So now Fiji has had 166 cases in total, with 114 recoveries and 4 deaths since our first case on March the 19th, 2020. Due to the temporary shutdown of Fiji CDC, we do not have the most recent testing data available. As Dr. Fong has mentioned today, we're going into a period where a lot of you will be asked to sacrifice. It's a complete lockdown for the areas that were mentioned. Dr. Fong, myself, Dr. Chemesa, we're just 3 of thousands of healthcare workers and other workers in other areas, such as the discipline forces, who will not be able to stay home, who will be out there working to protect all of us, working to stop this outbreak. So we do ask, as we've asked every night, that if please do your best, please stay home. Don't leave your houses unless you have a medical emergency. Please do this. Please help us. Please help us get this outbreak under control. Thank you.
Good evening. So today is day 29 of the current outbreak, but the health services continues throughout the country. In the Western Division in Lautoka, the services that have been put in place are progressing well, and we are happy with the services that have been provided. Lautoka Hospital continues to operate as the COVID hospital, and has continued the screening of the 317 staff at the hospital with no new cases, as well as the 207 patients that are currently admitted at the hospital, which includes 51 mothers and 46 babies. The FIMET hospital also is in full operation to date, and the team are also looking at the need and the demand from the population of Lautoka on the FEMAT field hospital, and there are consideration for increasing the scope and the capacity of the hospital. Our screening and contact tracing work continues. We have reduced the number of stationary screening clinics that we currently have operational to better focus our effort and our attention. So we currently have 55 clinics that are operational, and these sites are always updated in our website and periodically in the mass media. In the last 24 hours, 5,121 individuals who were screened at the stationary clinic, of whom 556 were swabbed. In the mobile community screening currently carried out in the main population centers in nearly all provinces in Fiji, 25,152 individuals were screened, and 1,205 individuals was swabbed, which gives a total of, to date, 413,678 individuals screened through the mobile screening clinic, and 12,050 swabbed. In our community isolation facilities, we currently have 86 individuals in 3 community isolation facilities. And as I've stated before, these facilities have positive cases and are therefore out of bounds to the general public. This weekend is about focusing on our home bubbles. We're requesting families and individuals to make every effort this weekend to protect your home bubbles from the virus by not letting anyone who does not reside in your home to come in. While at home, strengthen the practice of COVID-safe measures with your household and make that a priority. Talk to your family members about the do's and don'ts of COVID-safe practice. Download educational videos if you can, and learning materials from credible sites such as the WHO website, the US CDC website, and the government website on how to safely and correctly practice COVID-safe measures. Example, the correct way to wash your hands, the correct cough and sneezing etiquette, how to make proper homemade masks. Teach younger members of the family on what a bubble means and who should be the members of your home bubble. These measures will come handy at the other end of the lockdown, as they will protect us and save us and our family members from this deadly disease. Nawalev.
Thank you very much, Dr. Fong, and also members of the media who are tuning in on our virtual press conference. We will now open to questions. We will start with Fiji Times. Thank you, Felix.
Mula Dr. Fong.
Yo, Bula.
This is Felix from the Fiji Times.
I got you, Felix.
Before I ask my question, I just want to wish you and your team well, especially the members who were infected at the CDC. My question is this: do we have enough consumables available?
Okay, Felix, I presume you're asking about consumables for the test, eh?
Yes, consumables for the tests.
Thank you. So essentially, yes, we do have enough available, but I think I'll let Alicia come and update on what's happening with regards to the testing and with regards to the new supplies that are coming in.
Thank you. So in Fiji, we do two different types of tests. One is the open RT-PCR, which happens at Fiji CDC, and which we started on March the 11th of 2020. This is the conventional, this is the PCR that you see happening all over the world, and was developed quite early in the pandemic. The other one is the GeneXpert or KEFID GeneXpert Express machine, which is a type of PCR as well, but happens in a smaller contained unit. At the beginning of this year, we were able to decentralize this testing out of Fiji CDC, specifically the GeneXpert, to other labs in Fiji. So CWM Hospital, Tamavotumi Hospital, Lotoka Hospital, Lambasa Hospital, they all have some of these machines in their labs so that they can do this testing on site. Nevertheless, we do know that Fiji CDC was doing the bulk of testing simply because we have more of the GeneXpert machines, because we also have the RT-PCR, we had more staff, and the entire facility was dedicated towards COVID-19 testing. Now, with Fiji CDC going offline temporarily, we've had to rely more on these divisional hospitals for the testing. We do have enough consumables, both for RT-PCR and for GeneXpert. So once Fiji CDC comes back online, we'll be able to go to full capacity again. We also will be receiving a big number of new GeneXpert machines early next week, which we'll also be pushing out to these divisional hospitals. So we expect that this testing capacity will increase. So we do have a temporary setback at Fiji CDC, but going forward, we know that not only will our capacity increase, but it'll also be a more sustainable in terms of having that capacity spread all across Fiji. Thank you.
Sorry, I've got a second question. How many lab technicians do we have in total, the staff that do the testing? And with the ones who got infected, how has that impacted on the CDC's ability to test?
Thank you. I won't be able to speak to how many lab staff we have in total across the whole country, but at Fiji CDC currently we have 15 in total. 15, these are just lab staff who are dedicated to lab testing. Other than that, it's not just lab staff that are needed for COVID-19 testing. Because of the sheer volume of testing that we do, I think the most that we did in one day was about 2,200 in the last few weeks. And our average has been close to about 1,700 per day. So not only the testing, when a sample is received at the lab, it needs to be logged, it needs to be categorized. Some of our leaders have been up there and they marvel at how detailed that categorization and logging is, because it's very important that samples match patients. So it's not just the lab staff that we have there. We also have staff who ordinarily would be doing our surveillance work, who have come in to help the lab staff. They're doing things like data entry, so that every night when I'm up here and I'm giving you the data, the statistics, that's also coming from Fiji CDC. They collate the data that's in the lab, their lab, and they also pull in the data that comes in from the other lab. So it's a whole process that is not just explained by the number of lab staff that we do have on site. So whenever we do increase our capacity, we're not just increasing in terms of machines, in terms of consumables, or even in terms of lab staff. It's a whole process that needs to be upgraded at the same time. Thank you.
Thank you, Felix. Now we'll open the questions to Fiji Village. Vijay.
Uluvinak, Dr. Fong, Dr. Alicia, and Dr. Chemesa. Thank you again for all your hard work that you're putting in and the hard hours. No doubt tough times that lie ahead, including with the lockdown starting tonight. Dr. Fong, my first question is in relation to, and this question has also been raised by the retailers asking that if this can be considered, and if the health authorities are looking at this, taking into account the social issues also that matter at the moment. Are you looking at utilizing the RFMF and NDMO to deliver straight up 2 weeks of rations for those who are the most vulnerable and go straight for 14 days lockdown to try to flush out this virus? Because if not, we may have a situation. I noticed you said that we should try to put a firm halt on this virus, and whether with a shorter period of lockdown would achieve that, or we go for a planned process of having a 14 days lockdown to try to flush out the virus.
Yes, I need to be again clear. Whenever we do a short lockdown like we are doing right now, the current lockdown, the main idea is to stop whatever case is out there from moving and to swab them and get them sorted out, and identify the positives, and so that we can isolate the positives. So that's just from the current log of cases that we have. We got 4 days to identify any new cases, swab, and isolate. Now, if we were going to go for a longer lockdown that is aimed at actually removing the virus or reducing, trying to eliminate the virus from Viti Levu, then I agree with you. It will require a longer course of lockdown. At the moment, we are doing this one so that we can actually understand a little bit more the characteristics of what's happening around Viti Levu. We are hoping that by the time we come down, if we need to go for a longer lockdown, we can be more pointed in that lockdown. We can be more targeted in the areas that we lock down. So this initial 4 days is a phase for us to get as much data as possible. Unfortunately, we're starting off with our Fiji CDC, what we just described. That will be sorted out. That will be, we'll get Fiji CDC back online. We will generate a lot more data. And if we have to lengthen these current 4 days, we may have to lengthen the current 4 days so that we can get all the data that we need. Once we get that data, then we can start to talk again about planning for a longer course of lockdown if it is needed, and where would it be needed. So the point is, we're trying as far as possible to be as targeted as possible, because we also understand the socio-economic ills of prolonged lockdown. When I say socio-economic ill, many times we only talk about the economic ills, but the social implications of it are quite marked. Plenty studies have demonstrated to us the impact on gender violence, the impact on mental health. All those other things needs to be taken into account. So as far as possible, we want if we're going to do an extension, we want it to be pointed. We want it to be very targeted.
Dr. Fong, I have a second question. Thank you very much for that clarification. We shall look forward to the data and further decisions on that. It's in relation to Makoni. Makoni has become a red zone. A lot of cases have emanated from there. We have had some of those cases who have gone to other places where it's become a contact tracing nightmare, no doubt, for you and your team because of the movements. Are you looking at shutting out or having checkpoints in Makoni, where right now there's free movement in and out of there? And you did in Waini Tarawau settlement in Cunningham, you took that measure. However, we continue to see free movement in and out, people traveling in public service transport, walking around with masks. We had the acting police commissioner release a statement. There's some people who were caught even last night drinking alcohol in Makoni freely. What are some of the steps that you can take in relation to what I call a red zone, which is Makoni.
It's I know what you're talking about. For us, from a medical perspective, a proper red zone that relates to COVID-19 is a red zone that discusses and identifies where the spread of disease is in terms of its source and where they are at any point in time. Now, mapping out the spread of disease within Makoni is not easy because geographically Makoni links to many other places. So calling it a red zone from the disease point of view is not an easy thing to do. Calling it a red zone from the behavior point of view, that's another thing. That's another aspect of the operation that we have discussed. We had some discussions with the police. There are what we call red zones that we have identified based on behavior. And those are the ones that will have focused policing over the next 4 days. We will actually put in place stronger measures for those areas. One of the good things about the 4 days is that it means that people don't move. We can actually start looking closely at our distribution of resources within hotspots that we consider where people's behavior just have not looked healthy enough for us. And we can actually redistribute a lot more resources over the next 4 days, and then we can keep them there to sustain it over a longer period of time. So I guess just to clarify, we are focusing on what we call high-risk areas, but the high risk is defined by the behavior pattern that we're seeing, not by the distribution of the disease. And the police is actually working out the data on that one.
Thank you, sir. We'll now open to the questions to Fiji-san. Okay.
Bolovinaka, Dr. Fong and Dr. Elisha. My question is based on what you had mentioned in your statement. You had mentioned that the Ministry of Health would continue to swab people as we go through the lockdown that we are anticipating the next 4 days. My question is, with CDC inactive and with testing being done in operational testing facilities that are currently operational at the moment, what is the worst case scenario that the Ministry of Health is preparing for as far as results is concerned as we go through the lockdown and afterwards before we get the Fiji CDC back active again?
Okay, let me be very clear. We will get Fiji back and active again. The advice we got is that this is not CDC is not damaged beyond repair. And in fact, the requirements to get it back on track is not difficult. Right now, as I speak, the technicians who work the lab, they've turned themselves into cleaners. We ordered 50 bottles of Genola for them to go and scrub all the walls everywhere in the lab. And they're going to stay up tonight, not testing, but scrubbing the Fiji CDC. It can be fixed. We want to make sure that we can scrub it properly so that within 24 hours, by tomorrow afternoon, we can start getting our tests going again. Okay? On top of that, we do expect a consignment of test machines and consumables coming in very early next week. And those will be up in operation. So, if you ask me what's the worst case scenario, the worst case scenario probably at this point in time is that we have to extend the lockdown for a few more days because we haven't completely tested some of the swabs that we need to test.
I'll just add one thing. So there are two objectives of this lockdown that's going to start from tonight. One is to find contacts of cases, to get them swabbed, get their results back, get them into isolation. The other objective is to stop people moving, because as we know, as people move, the virus moves. So because we're having this lockdown, which is essentially a curfew, even if we're swabbing someone who's a contact of a case, and even if that result is delayed by a few days, they're still not moving. They're still isolating at home. And sometimes we say, okay, we ask people to isolate at home. When we have a few hundred people, it's very difficult for the Ministry of Health to put them all into quarantine facilities. So we ask them to home isolate. Now that we have the curfew, most people will have no choice. The policing will be much stricter. So we actually have this buffer period until early Wednesday morning, where even if test results are delayed, people will be at home. The transmission will be paused for this period of time. Thank you.
Enoch, are you done with your question? We'll now move to Live.
Thank you, Risti. Bulavanaka, Dr. Fong, Bula, Dr. Alisha, and Dr. Tunrabu. My question tonight is with regards to the KFPG app in the context of contact tracing conducted at the extra supermarket cluster in Flagstaff. My question stems from the numerous not complaints, but contacts from the public about having received as many as 10 pings, 10 SMS messages from their telecommunications provider telling them a variety of things from you may have been in contact with someone that had the virus and then almost immediately know you are safe and come in for a test or call them the 158. And so conflicting messages, numerous messages. And when they call 158, the response was conflicting there as well. There's a glitch, there's a hack, that's a mistake. And then sometimes 1 hour later, no, you're in trouble, wait for us, we have to come and swab you. Can you tell us what is going on with regards to the information you're getting from the KPG app? Was there a glitch, a hack, or a mistake? Please inform the public what to do when they get these pings, as we're now calling it out in the community. Minaka.
Yep. Thank you. There is no glitch, not that I am aware of, and none of those who are running the Fiji Care app are aware of any glitch. What I do know was that in the initial data that came across, we noticed that there was a big number of names in the list. And a Viber message went out to everybody based on that list. I did, together with a few others, we looked through the list again and realized, hang on, let's narrow this down a bit more so that we can filter down to the 2 meters and 15 minutes of contact. And we did that. Then we sent out another message to say that we are rounding up all those who we really need. You do not need to be swabbed. We are rounding up all those who need to be swabbed. As we became more concrete with our messaging, then we were able to say, no, you don't count as a contact, and others did count as a contact. As I recall, because every time they sent out a message, I got a message to tell me this message went out. I only received 3 messages. One that you're a potential contact, then the other one to say that we were narrowing the search, and finally the third one to say that you are no longer contact, you don't need to isolate, we are going to go for those who we consider as contacts. Those were the 3 that I got. Of course, the text message that went to the actual contacts, I did not get copies of each and every one, because that was about close to about 700. So from our perspective, the Fiji app and the way it does its contact tracing is working.
Vivek?
Thank you very much, Dr. Fong. I appreciate that clarification. And on that note, I would like to make a request that maybe this information be put on the government social media platforms for the information of the public. I'd also like to thank you for the response to our requests for more information coming out of the government. My second question is to do with your contact tracing and fact-finding work this weekend. Can you tell us the places that you're going to be doing your contact tracing, your trace, swab, and test, as you explained? Can you give us a list of the locations where people can expect to let your people in to cooperate and to be part of your process?
Yes, most of the work really will be situated around the Fiji Care app information that we have got, the contact traces that that were generated from that group. And there's another case in Lakena that we have to sort out the context of that group. In as far as what to expect and when to expect, a lot of that is dependent on the distribution of the contacts. And as I see it, one of the reasons why we asked for a lockdown of the Suvarnasori corridor and we did not ask for Lami to be included was because we could see that most of them were in the Suvarnasori corridor. And that's also the extent of the distribution that we could work out. Otherwise, the contacts are quite liberally distributed within those two areas.
Thank you very much, Dr. Fong. If I can just add another question, it's to do with we saw earlier this week that the family of a well-known sporting personality was able to leave this country, and we understand that the current instructions are no flights in or out, no traveling in or out. We're also hearing plans being made by some of our neighbor governments to repatriate their citizens. The U.S. State Department has now issued travel restrictions against Fiji. Can you tell us what is the word? Are people who are not nationals, who are not Fijian nationals, able to catch a seat on one of our freighter flights and go back home?
Thank you.
Can they organize?
The reason we restricted travel going out was really because when anybody goes out of the country, they use up resources. First, we have to do pre-departure testing. We have to set up a plan for the police to open up the border for them. There is some people who actually need to be monitored in terms of their movement going towards the Nandi airport. So in the initial part of when I called out and said no traveling out, the intention really was for us to refocus all our resources back on our screening program. As things have evolved, I have allowed quite a few people to go out. The Serevi family was not the only family that I allowed out. There is many more, and there are many more on my table that I am allowing out in accordance to the amount of resources that we can generate to make them safely go out. When I say this, that means that in the next ensuing few days, we're going to have difficulty giving anybody an approval to go out because we are limited in terms of our testing capacity. Our ability to turn around a test in 72 hours is going to be limited. As soon as that opens up, then we start again, you're giving them the ability to go out of the country. So everything is resource-based. And everything, because it's resource-based and our resource base has an ability to change, given the escalating cases that we have, my decision will have to change as we move along. It's not being unfair. It's just that the amount of resources, the challenges we face keep changing, so I have to change according to the resource base that I have with me. Thank you.
Thank you, Linde. We'll now move to Fiji TV.
Good evening, Dr. Fong, Dr. Alisha, and Dr. Chimisa. My question is for Dr. Chimesa. Can you please elaborate on the importance and the effectiveness of the screening clinics, considering our COVID-19 patients are presenting themselves at the health centers?
I think I've addressed this question in one of our earlier briefing. This is exactly why we've set up the screening clinic, so that we can identify patients in the community who may have symptoms and who need to present to the hospital, that they do present to a place where they are not accessing the hospital directly, but it's a place where the staff are prepared, and the screening is done safely. And when a patient is identified, that they can be safely escorted to a hospital for their further treatment. So at the moment we have 55 screening clinics in the country, and we are encouraging members of the public, all Fijians who have symptoms, that they either call the number 158 or present to these clinics. We've diagnosed a fair bit of our current positive cases from the screening clinic, and we are happy that it's serving the purpose. So we are encouraging members of the public to make use of the screening clinic. They have nothing to fear from our team on the ground, and the screening clinics staff will ensure that their testing are done, and they are, if required, directed in an appropriate manner and a safe manner to a hospital that will treat them of their illness or presenting complaints. Mark.
Thank you, Dr. Chimesa. Thank you, Dr. Chimesa. My next question is for Dr. James Fong. Just in terms of the screening and testing this lockdown period, how many health officials will be going out to conduct this testing and screening, and what is your target in terms of Suva and Sorry lockdown area?
As I mentioned, I think I did mention to you that there is something like 800, 900 that we identified on the Care Fiji app in the Suvarnabhumi area. Stemming from the Lakena group, I unfortunately do not have the numbers with me. I know that it's in the hundreds, and that I mean they currently doing they got a list up at with the Nausori subdivisional team. The exercise is going to be big. I mean, as I mentioned to the previous reporter, the size of the exercise is dictated by the landmass that we are locking down, and that's the Suvarnabhumi area. But when we just a quick look through all the information on the contact tracing app and the ones that we're receiving from Nausori, the information we're getting is that a lockdown between Suva and Nausori is more reasonable than extending it beyond that. I guess what I'm saying is that I can't give you the exact numbers, but I do know that the size of our lockdown is appropriate for the distribution of the cases that we got.
Thank you, Dr. Fong. We'll now open the mic to My TV.
Hello, Dr. Fong.
Hello.
Dr. Fong, you mentioned how one of the targets for the screening this weekend is that you're looking to have a map out a clear idea of the extent of the transmission. So what sort of indicators or benchmark are you looking at to be able to gauge the extent of transmission, to be able to say zero in on, and map up, the extent of the transmission?
As I said, the 4 days we got ahead is once you got the data from the 4 days, it maps out the next steps further down the line. The 4 days is not going to stop anything. The 4 days is to gather as much information as we got to decide on longer term measures that are required to actually stamp out the virus. The only information that I've got for sure is that we have new cases evolving within the Suva Nosori lockdown areas or contained areas, and we have generated a wide variety of contacts from them. You can note that we still have not got any more new cases out of Ra, and I'm still looking at the data in Ra so that people can generate for me the screening and the swabbing data from Ra that can allow us to confidently say, okay, Ra looks a bit more COVID contained. We have done a similar exercise in Lambasa at the beginning of this whole exercise, where we did a massive campaign of swabbing and testing, and we are far more confident that the North is COVID contained. The main parameter, of course, for COVID containment is if you don't get new cases in your screening clinic. The point we're making also is that we are confident in our distribution of screening clinics and in the criteria that we're using for swabbing and testing, that it will tell us when there is no more cases in the community. And basically, when there is no cases being reported, say, for at least 3 weeks, if not 4 weeks, that gives us a lot more assurance based on our testing capability and our screening strategy that we are moving closer and closer to being COVID contained. So at the end of the day, the main criteria for COVID containment is the number of new cases that we generate out of our screening program.
Thank you, Dr. Fong. One other question. Condolences to the family of the deceased. This is about the lady who died in Makoni. When she presented herself at the health facility, she was in a stage where she was infectious. I understand that there were screening done in that area as well. Is there, how did the screening team miss that? Do you have cases like that happening in other areas as well?
All I can say is the screening team did get around to the household. I was told that they did get around to the household. There was no symptoms reported. At that point in time, the household did not meet the swabbing criteria. And when they presented to Makoni, yes, she was quite sick. I think, I would like to say that that is about as much information that we got about the case. I must admit, I feel a little bit nervous having to try and give more information because I do not want to throw any negative permutations around the family. I'm just happy at the fact that they were assessed previously. The family was not regarded as having any evidence of disease, and we did present 2 weeks later with severe symptoms, which was recognized. I mean, the staff in Makoni knew immediately that these symptoms looked dangerous. So all those who came into contact with the patients were all in full PPE. They actually emptied out the place even before they started managing the patient and making sure that all those who came in contact were in full PPE. And then they started managing the patient and arranging for the referral.
Thank you, La. Now we'll move to FBC. Kroy.
Good evening, Dr. Fong, Dr. Sahukan, and Dr. Tunravu. Thank you again for your daily updates with regards to COVID-19. I have 2 quick questions. First one being about the testing capacity. I understand that there are testing underway in other sites across the country. However, given the sheer number of testing that is normally conducted at the Fiji CDC, and now that it being affected, how far behind are we in terms of testing? And do you fear that this could lead to a possible explosion of cases if and when testing at CDC resumes?
One of the, I think Alicia touched on this, one of the biggest benefits of, I mean, we have no control over the fact that the testing in Fiji CDC had to stop. That is beyond our control. There is a high standard of laboratory standard that we have to maintain, and if laboratory standard is not high enough, we stop, we clean, and we'll get back online. Now, the second thing that was alluded to was the fact that because of the lockdown, we know that we can swab, we can find you, we can swab those who need, all those who are supposed to be screened. If there is a positive among them, we know that because of the lockdown, they won't move much. So it just so happens that we're having a lockdown at a time when our testing capability is dropped. But we are also confident that it's still the best thing to do is to continue the lockdown, because it also means that if we swab you, we find you, we can keep the specimen aside, get the lab back online later tomorrow, and then start testing and catching up with all the backlog. The backlog that we have, there's a sizable backlog, but it can be, we will catch up with it, especially given the extra capacity that we will be receiving early in the week.
Thank
you, Kroy.
Let's have one more question. Thank you, Dr. Fong, for that response. Just quickly, with regards to the last lockdown that we have for a weekend lockdown, rather, the Ministry of Health, together with other relevant bodies, were helping in distribution of rations. We know with the ones that will be starting from Sunday noon onwards, and for people that will be calling in and texting in their details, how are you planning to ensure that people will not abuse these?
Yes, I think the Ministry of Economy has generated a statement today that has outlined the process that is there. And I mean, one of the things that we are very thankful for is that given that the Ministry of Economy has its own machinery to assess and distribute the rations, it does mean that the Ministry of Health will only focus on testing and swabbing and containment for during this lockdown.
Thank you.
Thank you very much, Dr. Fong. Thank you, Dr. Sokan and Dr. Tudrawu, members of the media. Thank you so much for committing to our first ever virtual press conference. That also brings us to the end of our press conference tonight. We hope to have you again tomorrow evening for our daily updates. Minasar Valeu.